Our next speaker, Vince Kuraitis, is principal and founder of Better Health Technologies. He is also an advisor on healthcare strategy, business models, and partnerships. He is faculty with the Fast Future Executive. Please welcome Vince.
And my presentation will be about how we can all live longer. But I'd like to start with telling you a story about my mom. This is a photograph of my mom taken in 2006 with her dog, Benji. My mom would visit our house in Boise frequently, and she knew the area. One day, Mom decided she's going to go to the grocery store, something she does all the time. Mom didn't come back for hours. We started getting worried. And she came back and she said, "I got lost." We laughed. She laughed. We went on with life. 3 years later, about 3 years later, Mom was diagnosed with Alzheimer's. We then, in hindsight, could see this first indication of her decline. And this introduces the topic that I'm going to be talking to you about. The opening slide talked about crazy ideas in healthcare. And the current administration in the US has what some people see as a crazy idea. It's listed here, a renewed focus on chronic disease. I am going to try to be as non-political as I can possibly be, because I think this is a really important topic. And my single objective today is really just simply to get this onto your radar screen. Okay, let's go on to the next one. And it's not working. Did the batteries die? Okay, there we go. World Economic Forum, chronic disease is our biggest health challenge. 3/4 of deaths are attributable to one or more chronic diseases. I'm going to give you a list of what they are, but you'll already be familiar with them. In the US, 90% of healthcare costs are attributable to or are incurred by people who have one or more chronic diseases. It is our biggest healthcare challenge. Here are examples of common chronic diseases. Again, you're going to be familiar with these. Hypertension, diabetes, heart failure, COPD, depression, Alzheimer's. Those are the ones that make the list. Okay, so I would like to get some input from the audience, and I'll just invite you. I'm going to offer a pop quiz. What was the expected life expectancy of a person born in the year 1900? It's a worldwide statistic that I'm looking for. Just shout out some numbers. 50, 55, 37, 48. Okay. I'm still shocked by this. Here's the answer. Life expectancy worldwide in the year 1900 was 32 years. Today in developed countries, it's over 80. And we're about 5 years behind that in the US. So this begins to set the stage for chronic disease. Okay, I'm going to give you, in about 5 minutes, a 200-year perspective on the development of worldwide health systems. First, we had 1900 to 1950, which was the era of infectious and public health focus. Now, I'd like to be and this was the era where we achieved the greatest increases in longevity. I'd like to be able to tell you that these increases in longevity occurred because we had much better medical care, but I can't. So let me list off. They were really public health issues. Public health improvements in controlling diseases like smallpox, malaria, and TB, more abundant and safer foods, cleaner water. Not stuff like doctors, hospitals, drugs, public health issues. Okay? So let's go on to the next era, 1950 to the year 2000, where worldwide life expectancy increased to about 66 years. This is the era where we built and invested in the kinds of centralized health systems you see today. Big buildings, hospitals, doctors' offices. Again, centralized, we have to go to them. In the US, there were billions of dollars spent by legislation called the Hill-Burton Act, where the federal government subsidized the development of hospitals, very capital intensive. Okay, the era that we are in now is the era of chronic disease. And let me talk to you a little bit about some of the details here. Okay. It's widespread. So remember, with the statistic that I quoted you earlier, 125 years ago, people only lived till age 32 on average across the world. So think of chronic diseases as an almost inevitable part of middle age and aging. We now live longer. In 1900, we didn't have to cope with chronic diseases because people simply didn't live long enough. But today, 76% of adults have at least one chronic disease, and by the time you reach 65, 93% of adults have at least one chronic disease. The kind of health systems that we need to build are not the ones that we build today. Again, what we have today are systems that are built around hospitals, doctors, and centralized. What we need to be thinking about is a much more longitudinal perspective. Once you've got a chronic disease, and this is the nature of the term chronic, is for the most part, you are going to have it for the rest of your life. It's not a matter of cure, it's a matter of management. And so we need collection of data and monitoring your condition over a long period of time. The focus needs to shift also to management. We're not going to cure you of your diabetes. We're not going to cure you of your heart failure, but we need to manage that condition over time. Patient self-monitoring. Most of these conditions are very much affected day to day by what you do as a patient, whether you have exercise, diet, good exercise, good diet, etc. And finally, care shifts from centralized doctors' offices and hospitals to decentralized care in communities, in patients' homes, to wherever they may happen to be. Okay. But the problem gets even more complicated than this. 79% of older adults have 2 or more chronic conditions. And let me give you just simply one example of where this becomes really challenging. For most chronic conditions, the frontline treatment is some sort of drug, pill, pharmaceutical. To date, the way clinical trials have been conducted is if you have multiple chronic conditions, you are going to be ineligible for a clinical trial because the drug company wants to know what is the effect on diabetes, and they don't want the complications. But this reality really doesn't fit the nature of chronic disease because most adults have multiple chronic conditions. And the punchline becomes, we have a lot yet to learn about chronic diseases. Okay. The last era, the era of proactive health, where health systems will be built around taking care of or trying to keep you healthy in the first place. There are already many examples of proactive health, and I'll list you some of these. Understanding the harms of ultra-processed foods, food as medicine, hospital at home, being cared for, not for all conditions. And I'm not suggesting that hospitals and doctors' offices go away. This is really a new system, a parallel system. Fitness and medical wearables, mobile health apps on your phone. We actually have over 350,000 different mobile health apps. That number may also blow you away. We don't need that many. The number's actually decreasing. Health coaching, patient access to medical records, integrative medicine. These are examples of the systems around proactive health that we're beginning to build. Okay, so what are some of the levers here? And I work in healthcare. I've worked in healthcare for 35 years. I've worked with just about every kind of different healthcare organization. And this is a really complicated issue, and I'm greatly oversimplifying it, okay? But I do want to give you a few of the headlines here. First of all, how we pay for healthcare, particularly in the US. We've been on a 20-year march, and we've made some progress, but the nature of payment in the US is once you get sick, then we begin paying for stuff. And the incentives are for care providers, the sicker you are, the more stuff that they can do to you, and the more money that they get paid. Health systems are beginning to shift on paying for value as opposed to simply volume of care. Health data and AI. This is where the gap, for example, I mentioned to you around pharmaceuticals, can begin to be filled. We don't know how to treat patients with multiple chronic conditions. And there's not necessarily patterns. If there are dozens of different kinds of chronic conditions, there are different permutations that people may have. This is where data and AI can be really helpful in the future. Technology, wearables, we've begun to talk about that in other presentations. But typically, if you look in the past, there were only 6 vital signs: your blood pressure, your weight, respiratory measurement, O2. Today, there are hundreds of different vital signs being evaluated. We really don't have a lot of information yet, and the science of medicine is really relatively primitive compared to many other sciences that we have. So the first 3 things that I listed are really around the health system, but that's not ultimately where the leverage is. The leverage ultimately is with each of us individually in taking personal responsibility. An example, in the US, the obesity rate is over 40%. In Japan, it's about 4%. Now, there are multiple factors that explain this, but the point is it is doable, that there are countries and nations, the cultures are very different. In the US, as I told you, the longevity is about 5 years behind the rest of the developed countries in the world. Personal responsibility, so that includes nutrition. You'll be hearing a lot of this, again, from the administration, the focus on ultra-processed foods, eating a good diet, not living on Doritos and chips, red meat once in a while. Exercise, a very key aspect, being able to be personally responsible for maintaining your weight, your personal physique. So let me summarize here. 125 years ago, chronic disease was not an issue because people didn't live long enough for these issues, for these diseases really to become a part of their lives. Over the last 125 years, we've made tremendous improvements, first in public health and in building up healthcare systems. And today we have chronic diseases which are accounting for most of our healthcare costs and most of the deaths in our country. However, we don't really have all the right answers, and we have a lot yet to learn. I'm going to close with reminding you of that image of my mom and her dog Benji. Alzheimer's robbed Ultimately, my mom died at age 82 or 93, and the last 4 years of her life were robbed by this disease. I hope that this doesn't afflict you and your loved ones, and I hope I've succeeded in putting this idea on your radar screen. I thank you for your attention.